These days, sir, we are looking to start, as you have seen, we have already worked on adolescent girls' health issues. Now, this stress in student age, that's also getting a big issue. So, we are planning to have a conversation regarding that.
Oh, very nice. So I'm also interested in talking about this, but today, as you know, it is a Teachers' Day, so my students are waiting. So please excuse me, I will
Okay,
join very soon.
sir.
Thank you.
Happy Teachers Day, sir.
Thank you. Thank
Happy
you.
Teachers Day.
God bless you.
Thank you, sir. Thank you so much. Happy Teachers Day, sir.
Thank you,
Sir,
Pinky. Thank you.
how are you?
All good.
And you're having chai. I also having chai. Unfortunately, the coincidence. And sir, how is the preparations from your students? It was been in today, like on the occasion of Teachers Day.
It's very heartwarming response from students. All through year, we are working hard for the benefit of students. So the kind of appreciation students feel in their heart, that is a great treasure for us, a very emotional moment for us when students also appreciate the kind of work we are doing. So
We are so blessed, sir. We are so blessed.
emotional moment for all of us. It's indeed a great day.
We are so blessed to have you as a mentor for us or a guidance. Like you guide us so well. So, sir, I have one topic in my mind since like last night. Like, like every time when there is no success or the day when you appreciate Arun rather than me, I feel a bit stressed. Or anytime when I've been low graded at any point, I usually feel stressed. Then I came to know yesterday night I just done a rough survey or research on this. There are many adolescent, younger generation or adults. There are many suicidal or depressed or stressed,
Indeed, indeed.
anxiety faced students or children nowadays. So why do you think that, like what will be the what is your view on that, and what is the stress and where it comes from?
Yes, considering our present generation of kids in India, it's a very big problem because present generation, Pinky, I will tell you, it's very aspirational. There was a time when students couldn't dream big, considering their family circumstances, considering their financial constraints. But in present times, when you have got access to internet, when you have access to all the information and opportunity available, so every child now has got a very ambitious and big vision in life, and a large number of them are quite supported. We have a big and rising number of middle class family which can afford to give their children at least the best. The other generation, the parents generations, are one who may have faced some constraint, financial constraint in their life, but they are not leaving any stone unturned for their children. They are giving their best and sometimes even beyond the means. Now there is a very unique situation where students feel, and the young kids feel, that they have to do really big. They are seeing all the great achievements around the world, and at the same times, the way parents are investing all emotional and financial resources, students and youngsters feel a lot of responsibility towards their parents. They want to really achieve success. But one old legacy that our society still carries is, we have defined success in a very narrowed down way. Like, you are successful only if you become a IAS, or say if you become doctor, engineer, CA, lawyer, architect, but very narrowly defined. All the other things are considered okay, but still not that desirable. Like anywhere, even in developed societies, the number of seats in medical colleges are limited. So are the seats in engineering colleges. If large number of students aspire for the same many number of seats, definitely the competition rises. If you look at the history, you find past 10 years we have added more number of medical seats than it was all through our independent India. Like past 10 years we have added 40 to 50,000 of medical seats, but they are still not enough. Lakhs and lakhs of students are aspiring. Now, in this mismatch between all the students' desire and their achievement, like if 10 lakh students are desiring to get into medicine and we have only 90,000 seats, so rest 9 lakh students, they don't know how to cope with this. Same way with engineering, CA, IS. In Delhi, if you look around, there are huge colonies where students from all around India, they are coming with dreams, they are working really hard, working day and night. But as we know, there is only a limited number of seats available to become an IAS. All those who could not achieve their first dream, now they always have a twitch in their heart like I was not good enough. I couldn't fulfill my parents' dream or my dream. I couldn't feel worthy enough of my parents' love, affection, and financial resources they invested. So, first thing, Pinky, what comes to my mind is we need to be ambitious. That is good enough. All the developments become because of ambition. But we also need to instill in everyone's mind what is bottom line of our existence. What is, if it is available to me, I should be happy and work my best, and whatever comes my way, I accept it. So the bottom line from my understanding as public health scientist, as professional, and as a adult now leading in the field is health. If you are healthy, if your body is fully supporting you, there is just no cause to feel disheartened. There are people who are even what we call Divyang and still they are also achieving. But yes, definitely there is a limitation of their physical capability. But if your body is fully capable, if you are healthy, reasonably healthy, then there is no point of feeling stress of deficiency. Beyond that, every day if you make meaning out of it, definitely you can achieve. But I would like to agree with all the motivators and all the teachers at one point when they talk to every student and say, every one of you can become doctor, engineer, or IAS. It's injustice to the students. We don't have 10 lakh number of medical seats, we don't have 20 lakh engineering seat, we don't have seat for 30,000 IASs. So we must prepare our students for realistic expectation that all of us can work very hard. Some of them, some of us, if we succeed in our chosen field, will contribute as doctor, engineer, lawyer, CA, architect, IS. But if it not, then we can go to other direction also and achieve well. So that is one point through the discussion I want to convey to everyone, parents and teachers.
Sir, okay, let me enlist the categories which really involve in this stress or depression or whatever it may be, the lower stage of the mental health of children. Let me categorize into three parts. First thing, the peers, the youth or the students who are involving in the victim with the victim, and secondly it's parents, and thirdly it's government. So we can discuss about government and parents later, but being a student or being a young adult or something, what steps we have to do to get out of them from the stress? So what should we as an individual should do or promote to get the help for them?
A very important insight is all of you, including you and all the students, first focus on your bottom line, what we talked about. Your bottom line is being financially independent and being physically capable. So create a culture where you yourself work hard on your body so that you keep your body healthy, which is the very fundamental level. We need to be fully efficient, fully working. Then only we can grow and bloom as full potential adult. That's number one. So you should indulge in regular daily physical activity, good food, and as student, as peer group, you should create a positive group where you do exercise in group, you eat in group, healthy food. That's number one. Then talking about right and positive stories. Stories transform the human life. What kind of stories we listen to creates expectation in us, and if we listen to right stories, we create great expectations and great career, great life. And that's why all the culture across the globe, we had the right story. So I would request to you that between you, always look at positive stories. We have in our entertainment arena horror and all the greasy crimes and everything, but beyond that, you go for positive story, because you are in your life at a stage where you are building life. To build life, we should be surrounded with positive stories. Then uh, a very unique cultural insight is, now we don't interfere too much in others life, but it is going now to an extent that we don't know at all about the people with whom maybe we are spending the whole day. That should be taken care of. If you find any sign that in your friends or peer group someone's eating pattern has changed, or maybe someone's walk sleeping pattern that has changed, that those are some of the early alarms. Then I won't say go beyond whatever they allow, but within a social range, do try to support, do try to not interfere in their life, but definitely try to add positively to your friends and peer group, because this is the group we thrive, and we can always be of help to each other. So I'm not at all suggesting we interfere in others life, but I'm always suggesting that we must be a positive addition in all the surrounding where we are staying, right?
Sir, and secondly, the family. I have seen the very poorest families where their economic state is like, it's okay, it's below poverty line, but still with the family encouragement or the family relations and all, the students or the children were so happy and so good. And I also see in the richest families where there is some relation between them and they are also super happy. But the point here is, the keeping the financial side aside, the parental thing, which is like underlying cause. I personally think the parental aspect is the main source of it. So how the parents should motivate their children, and how should they encourage them in getting out of stress and all?
Right. Parents have got a very important role right from childhood to every stage of our life. We as human beings, we have evolved in community. We are a very community animals if you talk at biology. Being a societal animal, community animal, we always thrive in a community. And more than finances, more than real physical needs, we thrive in a place where we feel that we are supported with people. We feel that if we are able to share all our anxieties, our achievements, our failures with someone, till that point we never feel lonely. And loneliness for human being is much bigger tragedy than poverty or illness. Every individual might have felt at one point or other time illness or some financial constraint. But you also have felt that if you have someone to share with them your personal financial problem or say physical problem, then there is always a hope. A person gets hopeless only in situation when he finds that he can't speak his true reality to anyone. You can be rich, you can be poor, you can be supported with 1,000 people, or you can be alone. But if you have people or a community to share your tragedies, your success, and your failure, then you are never alone. And till the point you are hopeful, the word is hope.
Hmm.
Till that point, as human beings, we are able to function fully. And
Yes.
at the point when we lose hope,
Hmm.
even if we are rich, there have been uh, filthy rich people who had to get to the utmost tragedies of taking away their lives,
Hmm.
because somehow they felt that they couldn't manage everything, and they couldn't really find anyone with whom they can trust and share their tragedies.
Yes, sir.
So parents should actually very actively listen to their kids, and sometimes listen without judgment, sometimes listen without giving suggestion, reprimand. You need to have an adult in life who could listen to. And if required, he suggests. If not required, he just listens. It is required in our peer group if we want to support our friends. This is required if we want to support our children, if we want to provide care as relatives. This listening and sense of empathy, listening to your problem, being able to empathize what happened to you, that's also good enough without even having solution. Many times your parents might not be having solution to all your problems, but till the point you feel that they are there to support you, you are hopeful, and this key is hopefulness.
Yes, sir. And my last question or last aspect is the government. As we consider this is a national issue or a public issue where the rate of suicides are being, the attempts of suicides are being more raised nowadays. And also, not only suicides but also the taking of drug consumption or alcohol. Everything is like only based upon the stress. When you don't have, as you mentioned, when you feel alone, you need something from to get out of it. So they are going into the bad habits. So government also should look something regarding this. And what will you suggest, like what government should do in this aspect?
Two kind of measures could be done. One is short term, another one is long term. Short term solution are that we empower more of teachers and parents in able to support the kids. Many times parents, of course, I mean almost all the parents want to support their children, but not everyone is trained in psychology, not everyone is trained in supporting how to provide care to, like we teach CPR for emergency care. Same way, we need to have more of such kind of small courses for parents and people at large, how to support people who are in the need of emotional anxiety or emotional health. And even as lay people, we have got in our hands big responsibility to support people who are vulnerable, who are right now in need of emotional health, as friends, as siblings, as parents. So in short term, we could have more and more of such kind of trainings so that we have large number of people who have got at least skilled at basic skills of emotional support. That's number one. Number two, you will be really surprised to find that the concentration of the average number of psychologists available in society. Here in Bharat, we still have very small number of psychologists available per 10,000. So that's also one area, but that area requires change over 8 to 10 years. You develop colleges, you develop training facility, then people come out, they get trained, then they are available in schools and colleges. So as I discussed, government has come up with lot of facilities. In every school now they are having psychologists who are taking care of children. Universities also have their counseling centers. We can make it also more available, some community based emotional support centers. The way we have community nurses, the way we have PHCs, we can also have some centers which are, maybe they are run by NGOs but supported in one way or another by government, where we can provide people who are in the need of emotional support, certain specialized care. But first thing which I feel is most important, that is providing the basic emotional support training to all the young adults in society and parents together. If everyone is, I use a word, emotionally literate, I would say a large number of people are not emotionally literate. For everything they want to provide a solution, where they need to just provide a listening ears, they are providing solutions. So we have lot of gyan dispensing people, but not enough people who could listen with intent and sincerity. And then as we have start having more of psychologists and specialized counselor who could train, definitely we can impact better.
So thank you so much, sir, because every time when I sit with you and listen these kind of like unsolved, some questions will be in my mind and I, which are like unanswered. And every time when I sit with you, I'll get more gyan from you, and I'm so thankful. And your words are like so strong as the chai. So thank you so much, sir. And we'll be meeting soon with another
Sure.
topic.
And rather through you, I would like to say all the people, public health people, you should come up more of programs like emotional literacy program or first response of emotional crisis. That way we can make society better equipped to treat and deal with emotionally vulnerable people.
Sir, after listening to you, I got one like a phrase in my mind, like a failure is not a failure always. It will be like one day they will be also successful. So no need to be stressful, because everyone speaks only regarding success. Nobody will speak the one who is like the failure. Nobody will speak.
True.
But still they have many things in their heart. But
And
your words
essence,
nowadays now it definitely make at least one or two to feel like okay, it's okay to be a failure. So I'm so thankful for you, sir, and like this is like most excited topic till now for me, sir. Thank you so much.
thank you.
Thank you.
Thanks a lot.